Hello everyone, Anna here. So pleased to have your company. A recent study released just this month actually by Stoliar, Darlin and Sheehan reported upon results of a survey of 447 Australian midwives regarding their own prenatal and birth carer choices. Results showed that over 85% of respondents received care under the model of their choosing, and that both the care models selected and birth outcomes observed were different to the general population. Rates of non-instrumental birth, for example, were 16% higher than for the general population, and caesarean births amongst the midwifery cohort were less than half that seen in the national rate. The authors of the paper note, Australian midwives appear to have the advantage of clinical and scientific knowledge to navigate the maternity care system to get the birth care and outcomes they want. One interesting finding, for me at least, of the study was regarding the rate of home birth. So while the national rate for home birth among the total population is less than 0.5%, a whopping 11.2% of the midwives responding to the survey, or 11.2%, of the midwives responding to the survey reported having a home birth. It seems that many of those who work in hospitals would rather birth outside of them, which kind of brings me to introducing our next guest on this episode of the podcast, Kate Elizabeth. She is a private practicing midwife, as you'll hear. She's planning on welcoming her third baby to her family and is doing so via her second home birth. So I will leave it there and we'll get stuck straight in. Actually, not quite. Before I begin, I want to let you know about an upcoming workshop that I'm having on 26th of August, which is a Friday, up at Port Stephens, Corlett. So if you're around Medowie, Port Stephens, Newcastle area, I invite you to come along to Beyond Mum Guilt, Finding Ease as Responsive Parents in an Under-Supportive Society. There is a creche available, and if you are looking to extract yourself from that nasty cycle of guilt, overwhelm, anger, and find your groove in parenting the way you want to, without feeling like you need to read more and more and more peaceful parenting literature and that you're always screwing it up, I'd love to have you along. So I'll include a link in the show notes, and you can also follow along by my social media and get to the registration page that way. All right, let's listen to what Kate has to say. Hello and welcome to this very special episode of the Anna Asks podcast. Today I am speaking with Kate Elizabeth, who is based in Melbourne, Naarm, and is a midwife. Like me, she is currently pregnant. She is expecting her third baby into this world. I asked her to come on today as somebody who really knows the ins and outs of birth and this whole perinatal period, to find out not only what she would like to share with a broader audience, but what she's doing for herself at this point in time. So before we begin, I'd just like to acknowledge the traditional custodians of the land on which Kate and I are today. So I am on Awabakal country up around Awaba, Lake Macquarie, New South Wales, and Kate is on the lands of the Wurundjeri people. So Kate, I'm going to hand the mic over to you and ask you to introduce yourself, please.
Thanks, Anna. I'm Kate Elizabeth. I'm a mum of two with one on the way. I am a midwife. I've been a midwife for over 11 years. Also in that time, I've branched out and I'm a childbirth educator also. I specialise in postpartum care, and I'm actually now a private endorsed midwife offering home birth services and shared care.
So before you go too far, for people who don't know how these different midwifery qualifications work, what makes a private practicing midwife different to a midwife they might have met in a hospital setting?
Yeah, being a private midwife, I am endorsed through Medicare and APRA. So I've gone on and done further studies, extra clinical work that makes me an endorsed midwife. So I have a provider number through Medicare. So when I see women through their pregnancy and postpartum, I can actually access Medicare rebates, and I can basically provide all care for women in collaboration with GPs and obstetricians.
Awesome, thank you. Did you have some more that you wanted to add about your professional directions?
I cover from pregnancy through to motherhood. So I have a whole range of things. Yeah, I like to work across the continuum. It's not just about birth, it's not just about pregnancy. I think they all interconnect together. So that's what I like to offer.
What was it initially that drew you to do that kind of work with families? Was it an obvious choice, or did you come to midwifery, and particularly home birth midwifery, in a roundabout way?
I actually always wanted to do nursing, and I have an older sister who's 10 years older than me. So when I was about 15 or 16, she had her children. It was definitely my nephew. He was my second. So she had a daughter and then a son. And I remember going into the hospital and meeting him for the first time and him wrapping his little hand around my little finger. And then I went and lived with her for my school holidays for 2 weeks to support her postpartum. And yeah, that just cemented it. I was like, yep, I want to work with babies. But then when I actually became a midwife, the babies to me, yes, they're great, but they're kind of the added bonus. For me, once I became a midwife, it's actually more about the women and the relationships that I build with women and being able to support them on their journey. So I did join midwifery for the babies, but I stay in it now for the women. So that's what I mainly get out of it.
And I think that's what we find time and time again in the birth and postpartum community, is that the people who stay in it stay for the women and the birth parents and the families. The people who are in it only for the babies don't stick around too long.
Yeah, correct.
With these things in mind that you've discussed already, how are you approaching things for this pregnancy, this birth, this postpartum period that might look different to how you've done it with your previous children? Or are you going on a very similar track because it's worked brilliantly for you?
So this baby was definitely a big surprise for us. I am 41 and I hate the terminology, but I'm a geriatric mother, which I just hate that terminology. But yeah, definitely a big surprise for us, this baby. So I had gotten rid of everything. I was not prepared. But in saying that, I'm very happy that I'm having this little baby, but I'm very excited to be birthing again. I did go through a grieving process after my daughter that I would never experience birth again. So I've definitely been sitting with that a lot. Excited. He's still got time to come, but I'm ready to birth. And I'm doing a home birth this time, which I did with my first child. My second, I actually birthed in hospital. And that was, at the time, that was because I was living in rural WA. I was in Karratha at the time. And there was no midwives in the community that was willing to support a home birth. So I opted to go into the hospital for that birth. And on reflection of those two, which I know as a midwife, continuity of care and all of that is gold standard. But when I had my daughter in the hospital, there was just no connection. I had breakdowns with both my children afterwards, postpartum, but hers was definitely much more significant. And I really believe that lack of connection really played a role in that. So this time I am doing home birth again, but I have a private midwife this time. With my son, I went through the government funded program. But this time, yeah, I've got my own private midwife who actually is a colleague of mine, and we do home births together. So we have quite a good relationship and connection already. But yeah, that's really what I wanted more, is that long-term connection. So she will be a part of my journey up to 6 weeks postpartum.
Beautiful. I can actually see, I know listeners won't be able to, but I can see behind you that you actually have some birth affirmations and beautiful cards hanging up there on a little string across your wall. Are these things that you have put up for you in preparation for your birth, or they're things that just adorn your office anyhow because now your work and your personal life are colliding again?
Yeah, this is my consulting room. So this is for my women that come to see me, a part of shared care and my private midwifery services. But I did have this when I birthed my son at home. I set up my birth space from about 35 weeks. So I just have the bonus now that I have a consulting room and I have a treatment room that's all basically set up already. So they have been set up for pretty much all the pregnancy so far. So yes, it's great to.
Do you actually dedicate any time for yourself to do particular practices to prepare for this birth, or you just trust in birth so much, you know it inside out, that it's not actually on your radar yet? Like, you're a bit ahead of me, being a couple of months ahead, but I'm sort of just starting to go like, you know, I read birth books for fun, and now I'm thinking like, oh, yeah, maybe I should do some like actual preparation, but I'm not fearful of anything, so I kind of like, I'm not drawn to bother with it yet. Where are you at?
Yeah, my preparation this time. So with my son, when I first birthed at home with him, I did a lot of preparation with him pretty much every night from about 36 weeks, maybe not every night, but pretty much most nights, because my husband would work of an evening. I would actually pretend I was in labor pretty much every night. I'd create a birth space in my bathroom or shower. I'd do candles, meditation, music, had my birth track. And I would talk to him and I would breathe like I was in labor. And I think that's really one of the, there's lots of bonuses for home birth, but that was, for me, was a huge bonus that I actually got to prepare in that birth space. So then when it actually came to the time that I did birth, it just felt so natural. And it pretty much went to how I had been practicing, bar I was in a birth pool and it was during the day, not at nighttime. That was pretty much the only difference. This time for me, because my older kids are 6 and 4, so with my other two, I've never had to really consider them. I have, but you know, like my son was 2 and had speech delay, so he just had no idea that there was a baby coming. We just went at that point where we could talk about it. But now with the 6 and 4-year-old, that's probably been my biggest preparation, is talking to them. I've purchased a whole heap of home birth books, talking to them about what will happen, what noises they'll make, you know, what they can do if they don't feel safe. And yeah, really investing the time with them to let them know that everything's going to be fine, and I'll bleed and it will be normal, and I'll make loud noises and that's okay. So we've been practicing each night. You know, we do dinosaur noises and cow noises, and we try and pick what animal I'm going to sound like when baby's coming out. So that's probably been my biggest preparation. But also, with saying that, I have stopped taking home. I've got one more home birth client left who's currently due. And then I've really stepped back from work so that I could really honour this pregnancy. I had to work up late in both pregnancies. So this time I really wanted, knowing this is going to be my last, I really wanted to honour the pregnancy and spend time with it and sit with it. And yeah, this time I know more about matrescence. I never knew about matrescence with my other two. So this time I'm actually looking forward to it in a funny kind of way, to my cracking open a matrescence, in the sense that I know about it this time. I'm sure it still won't be pleasant, but at least I'll have the terminology around it this time. So yeah, that's probably more my preparation in regards to all of that, more logistics and things like that. But I fully trust in my body and my baby that birth will just go how it's meant to be. And yeah, I'm very well informed in how physiological birth works.
Yeah, the preparing the older children is something that I'm getting asked about a bit. My daughter's 3. Our intention is to have her around when I go into labour, and we'll have her at home as well, where she was born here too. So she understands that. But the noises are something that are part of our preparation, but she's also quite noise sensitive. So I don't exactly know how this is going to play out, even with all of the preparation. She might choose to leave, which, you know, that's fine.
Yeah.
Interesting about the matrescence too. I think sometimes people kind of get this idea that it's like, you know, the clock starts at the first baby and then ends at some set point, but I think it does crack you open for every baby. And
yes, definitely agree.
yeah, and you go through all of those stages, perhaps not with the same intensity as the first one, but all over again there's new layers taken off. And
yeah, and each baby's different. They bring their own temperament, you know, they bring their own unique quality. So I've never have mothered this baby before. So
No. And you've never mothered within this new family dynamic that's
yeah,
going to
that's
come
right.
either.
Yeah. Yeah. So yes,
Fascinating.
everything's new. So yeah.
I'm wondering if you would be happy to speak a little bit on how some of the choices that you're making in terms of your direct choices around birth, or what resources and supports you're calling on personally and professionally, might be a little different to the cultural norm. You did mention that you are, pardon the label, but a geriatric mother on this occasion. There are other things that might be or would be considered risk factors within a hospital environment. And I just wanted to get your take on approaching this time of your life with that context.
My biggest influences on my birth, and they have been on my previous two, is the history that I come from. So the women in my family that I come from. So my mum's mum had 12 babies, and my mum was a set of twins, which my nana didn't know she was having twins until my mum started coming out. And then my dad's mum had 5 babies, also a set of twins. And my dad was born 12 pound, and the twins were 8 pound each, and the biggest twins recorded in the district at the time. So I actually have photos of them up, and I have them in my birth space. And for me, it's, well, that's what I come from. That's the lineage I come from. And if they can do it, I can do it. And it was very, not funny, but it was interesting when I was home birthing with my son, and everyone was like, oh my God, and you're home birthing? Like, your nana had a 12-pound baby and you're birthing at home? Like, are you crazy? And I was like, you're missing the point. Like, they lived. Like, she lived till she was 90. Like, she did it, like, I'm sure if she can birth a 12-pound baby, I can birth my little 3.5 kilo baby with ease. So definitely that plays a factor in just having the faith in myself and my lineage that I've got it and my body's got it. And age for me, yes, I'm 41. It's been a lot more painful, this pregnancy. My uterus is a lot more screaming out that you're stretching it. I definitely feel it a lot more this pregnancy. But with saying all of that, yeah, my body's strong, my uterus is strong, my baby's strong, and doesn't matter what age I am or what risk factors they consider in the hospital. I just have a complete inner faith that everything is fine, and this is how I'm meant to birth. And I'm meant to birth with my family. I want my children and my husband to see their brother come into the world, and I'll have my mum and my sisters here as well. It's a whole family event, and especially for my kids to witness that is, definitely important.
Because it's a normal everyday occurrence, as extraordinary as it is. Birth happens every day. Every minute that we're recording, every second someone's listening, someone is giving birth.
Yeah.
And if we don't meddle with it, it probably won't get muddled up.
Yes.
How you're saying it's important for your children to witness how normal, how everyday it is. I really appreciated, there was a post that I saw you do the other day on your social media, just saying, when I was having my previous babies, there was no photos that looked like me. There was nothing that I could relate to. And I think that representation and that visual is important as well. Is that something that you'd be able to explore a bit too?
I still feel that this pregnancy, I'm a bigger build. I just don't really see any photos or home births of plus size or bigger build women. When I was pregnant with my second, I've literally got one photo of me pregnant, and that was because my friend nagged me from Melbourne because I was in rural WA, and she was like, send us a picture. So if it wasn't for her nagging me, I wouldn't really have any pictures of that whole pregnancy journey, which in hindsight is really sad. The reason for not having them is purely confidence, and you don't have that nice little, even up to 20 weeks, you couldn't even tell I was pregnant. There's no basketball bump. you feel like you do miss out on that. But yeah, this pregnancy, I just really wanted to honor. I feel like a bit of a contradiction because I honor my body in so many ways in regards to birth. But then, yeah, I do have that confidence lacking in honoring it in how it looks when I'm pregnant.
I think in regards to not having it seen as much is because when the home birth is provided through government health services, women of that build risked out of it.
Yes.
Labelled out of it.
Yes.
And so unless somebody is going to birth with a private midwife or free birth, there's not the opportunity to be demonstrating
correct
what a body like yours is in home birth.
Yeah. And this pregnancy, maybe because I've hit 40, this pregnancy, I am heavier than my previous two. So the home birth program is not running currently now because of COVID. But even if it was running, I would have not been accepted because of my BMI, which is just a load of crap. But anyway, I wouldn't have been selected because of my BMI. I would have been, taken off the list straight away. So I would have been private anyway. But then, that's the bonus of private midwifery, is that we're not just pigeonholed into the system. We can actually branch out and seek the care and support that we want.
Which is really important, and so many people don't know about it, particularly for their first babies. It's something that you often find out about later when the first one hasn't gone how you wanted it to go.
Yes.
Is there anything that you are prioritising in your preparation that others might not have considered as important?
Like I said, I got rid of everything. So everything is new again, but I am very minimalist. I don't think babies need that much, as long as he's got me and dad and his siblings. I think he's going to be great, and some warm clothes because it is freezing in Melbourne. My priority has been cloth nappies. I've repurchased all cloth nappies again. I hate the feeling of throwing the disposables in the bin and how many they use, and wipes. And so going very which I have with my previous two, but I've actually bought newborn cloth nappies this time. I've got my selection of carriers, and I've bought a big family bed. That's really my priorities, is that I've got something I can hold him in, I've got something I can clothe him in, and I've got somewhere where we can sleep. And then the next main focus is the postpartum, which I'm lucky I have family around. So, and I already have a cleaner, so she knows that she'll be coming more frequently in the first couple of weeks after birth. Also, I have my sister, who's actually quite a great cook. So I've got her lined up and my mum, who will be doing a meal each week. And yes, the meal is for me, but the meal is also mainly for my children, so they are nourished and fed and feel loved while mum is in bed breastfeeding and not having to worry about the cooking and things like that.
Yeah, I love that you're thinking about how you can still get the most rest and recovery and be giving that baby what it needs, which is going to be lying down, feeding and sleeping a lot of the time.
Yes.
People do often ask me about how we're going to manage sleep with a child who does co-sleep kind of at least half the night. When you say about your big family bed, are you anticipating that perhaps your children might be coming to crawl in with you as well? Or do you mean more for your partner and your baby and you?
So I actually sleep with my children already. I've always been a bed sharer. So when I had my first baby born at home, we bed shared from the get-go, from the very first night. Then when I had my daughter, when we were in Karratha, we also purchased a big family bed, and all of us were in that bed together. And I had a side cot, which basically was used as protection because she was on that side and mainly storage. She didn't really sleep in it.
No, but it's that feeling that then they're not going to fall out.
Yes.
It's that buffer.
Yes, yeah. And then you can be right on the edge of the bed, because sometimes the toddler likes to take up a lot of room. And then this time, my children do have their own bedrooms, but they just love sleeping together. They wake up and they cuddle each other and they talk about their dreams. And so my son has a queen size bed. So my daughter doesn't really sleep in her bedroom. It's more for toys and clothes. And they sleep in there together. And then knowing that this baby was coming, because prior to that, I did sleep in my own bed. But they would, wake up during the night, and then I'd go hop into the queen bed with them. And then pregnancy insomnia and knowing a baby's coming, it was getting a bit rough because, I'd finally get to sleep and then one of them would wake up. And so then I was like, that's it, I'm just changing this. So I went and got a single bed. So we have the queen and the single bed joined together, and we all sleep in there together, and we all sleep. They don't wake up during the night anymore knowing that I'm there. And yeah, they know that it's the baby's bed and that the baby will be in there with us when he comes along. So dad gets a nice king size bed to himself. He sleeps, and then, yeah, we're all in the room together. And I just wanted to, one, I like to bed share, but two, knowing that the kids wake up, it's about protecting my sleep and about protecting the baby's sleep as well. I didn't want to have to get the baby asleep, or I fall asleep and then the kids wake up and then I go and hop into them. But then I'm anxious because the baby's in the other room because I don't want to move him. So it was more just, let's just bunk all in together. And they love it. They love waking up with mum there, and they love waking up together. And I anticipate that they're going to love waking up to a little baby as well.
I think so. And I think a lot of listeners will find that section that you just talked through very, very helpful in their planning. Before we wind up though, I do want to ask you, if anyone listening is wanting their experience to be different to first time around, or just altogether better than the cultural norm, what advice would you give them?
Find a midwife. It's really sad that women don't know that private midwives are around, and more in particular that they don't know that a lot of the thought is that private midwives just offer home birth services, and that you have to have a home birth to utilize that midwife, which is just not true. I know myself and a lot of other private midwives can offer antenatal and postpartum care, so the Medicare rebates go up to 6 weeks and 6 days, which is just massive, and the government provides it, and we don't have women using it. And if we don't have women using it, the government is not going to make these services better. They're going to be like, well, no one's using it, why are we going to invest in that? But if we can get women using these services, and especially in COVID, women would go and see their midwife and they'd have 15-minute appointments, or they're on telehealth. Some women weren't actually having a face-to-face till after 20 weeks pregnant. Or even in our local council, the maternal child health nurse is so fully booked that they're stopped seeing babies over 8 weeks. Like, they're just inundated. And then there's this service here with all these midwives who, want to see women and help them and have got the time and the space to see them. And it kills me when I speak to women and they have this experience and they've been told a certain policy or certain information, which when you hear their story, you can sit with them and pull it apart, and, they learn that it's been told for them for legal reasons or to keep beds moving. It's actually not in their best interest or their baby's best interest. So I just wish women would utilize that service more. And you don't have to have continuity of care is great, but even if you want to go through something where, okay, I've been told this, is this right? This is what I hear. This is what people are telling me. Can you talk it through with me? And just having that appointment with the midwife to sit down and talk through, birth, fear, preparation, anything. That's what we're all here for. It's not just about the birth. It's about so much more.
Thank you. Very, very valuable advice. Kate, where can our listeners connect with you if they would like to kind of follow along your journey and your work and tie in with you in any way?
So I'm mainly on Instagram and Facebook, and then also my website, which is kateelizabethparenting.com.au.
Brilliant. So I will include those links in the show notes for you. And just again, thank you for your time and for sharing your plans and thoughts to date. And maybe if it all aligns further down the track, then you can stop back in and tell us how it's gone.
I'd love to. We'll talk about the cracking open.
Oh, yeah. Yeah. And I'll probably be bawling my eyes out through the same thing because I'm expecting it pretty hard.
We don't want to go through it alone. That's half the problem, isn't it?
That's it.
Yeah.
Okay. See you, Kate.
Thanks, Anna. Thanks.
Thanks so much for listening. If you love this episode of Anna Asks, it would be a great help if you pop across and leave us a 5-star rating or review. This helps other parents and people to find us and join in the conversation. You can also become a sponsor of this pod for $2.99 Australian a month via the link in the show notes, or head to my website www.annacusack.com.au to grab my free postpartum preparation e-guide, check out my services, or grab my book, Mama You're Not Broken. Until next episode, bye from me, unless of course you want to come chat via socials at Anna Cusack Postpartum before then. See you soon.